This is Cate Swannell for the MJA, and today we're talking with Professor Tania Sorrell, Director of the Marie Bashir Institute for Infectious Diseases and Biosecurity at the University of Sydney, and her colleague Dr. Grant Hill Cawthorne, who is a lecturer in communicable disease epidemiology, also at Marie Bashir Institute. Welcome, you two. Thank you for your time. You've written an editorial for this issue of the MJA on Ebola. Why are we so afraid of a disease that's really, in terms of global disease, killing relatively few people?
I think the main concern is that this seems to be a highly fatal disease. In the past, there have been outbreaks where up to 90% mortality has been reported. The current outbreak is less than that, but it's still quite substantial. And so I think people are very afraid of this disease. And that's the main concern that people in Western countries have.
Is that high mortality rate because of the disease itself or because of the conditions in which it's occurring in terms of access to good health care, protective equipment, etc.?
It's a combination of the two. The disease or the virus is clearly quite virulent. That is to say, it causes severe disease quickly. The mortality rate can be reduced with early rehydration and other standard treatment measures. And of course, there isn't a cure for it that's widely available at the moment.
Right. Does it, it's occurring in very poor countries. Does that exacerbate the problem?
Absolutely. In fact, the main reason that it's spreading is lack of appropriate infection control precautions, by which I mean measures that will prevent transmission of the virus. It's not actually that easy to transmit. You have to come into contact directly with bodily secretions or blood. This in traditional cultures can sometimes occur around funerals.
Right.
It can sometimes occur, obviously, when there are very few available personal protective equipment devices, including gowns and gloves.
Right.
And so it's really the issue within the developing country of the healthcare system that's actually driving this apparent spread.
Right. Can you give us a bit of an update, maybe, Grant, on number of cases and which one of the viruses is doing the most damage and all of that sort of stuff? What's happening with it?
So we're now at the point where there's been over 3,000 cases.
Right.
It looks to have a fatality rate of about 52%, so about 1,500 deaths so far. One of the scary things about this virus is the number of healthcare workers are often involved. So there's been well over 200 deaths.
Right.
Notably, even on the recent Science paper that looked at the genetic epidemiology, already 5 of those authors on that paper have since died from the virus itself.
Wow.
So one of the big fears in many of these countries is the impact it has on healthcare professionals working there.
I think there's just been a case in Senegal, or did I hear that correctly?
Yeah, so we're now up to a number of countries being affected. So it started off, first cases reported in Guinea, we then had cases in Sierra Leone and Liberia. There's been imported cases in Nigeria, so altogether there's been 9 deaths. Right.
By imported, you mean people coming from?
People, yeah, who have travelled from West Africa and gone back.
Right.
With little spread occurring, luckily, in Nigeria. And yes, as you say, the first case was reported yesterday. Again, a returning traveller going back to Senegal, who then presented with symptoms.
So I guess the question that Joe Bloggs on the street wants to know is, what are my chances of running into Ebola here in Australia?
I would say it's extremely small, and the Chief Medical Officer, Professor Christopher Bagley, has said the same thing. We often don't have a huge amount of travel between here and West Africa, and even still, this will be well recognised by healthcare workers in this country. People are very primed for a fever in any returning traveller from this part of the world to investigate that thoroughly.
How are our infection control measures? Are we the best in the world, or are we close to it?
I would say we're at the top there with some of the best countries in the world. Certainly the CDC has published guidance, and Australia has done the same, to say that these patients, as long as you look after them with good infection control in a single room, isolate them from other patients and wear good protective equipment, the actual risk of transmission of the virus is very low.
Tanya, you said earlier there's no cure. Where are we at in terms of a vaccine? Or is there a preventative at all? Or
The best prevention is the infection control at the moment, but there are two approaches that are being used. One is to develop a therapeutic agent or a drug. The other is to develop a vaccine, and there are advances being made on both those fronts. People have probably heard of the antibody treatment called ZedMatt or ZedMatt. That consists of a combination or a cocktail of 3 antibodies which are active against the virus. Recently, and in fact as recently as this week, an article has appeared in Nature which indicates in a trial of 18 monkeys, primates, that this drug was 100% effective even when given up to 5 days after they'd been infected with the virus. So it's certainly appearing very promising. This is the same drug that has been used in a few cases of human disease.
Okay.
The other approach with the vaccine has also looked promising in that Tony Fauci, who is the head of the National Institutes of Health in the US, announced also a couple of days ago that there was a vaccine that's been developed to a stage where it can actually be tested initially in 20 healthy humans to make sure that it's safe before it can go into production and larger trials occur.
Okay. There was a lot of publicity about the American healthcare worker with Samaritan's Purse, I think. Was that a ZedMatt situation? Yeah?
Yeah, so actually both of the healthcare workers that worked for that charity when they were back in the US were treated with ZedMatt. There's also been a British nurse that is being treated in Royal Free Hospital in London who's received the drug this week. And I think altogether around 9 patients have received it so far. Okay. 2 of those have subsequently died, but a number of them have survived and have now walked out of hospital.
I think one of the issues with it is its availability at the moment.
Right.
There are a very limited number of doses that have actually been developed, and so scaling up that process is clearly on the agenda. But I would still point out that for this particular outbreak, the best way to controlling it will be adequate infection control and assisting the affected countries with their healthcare systems.
Okay. Does the fact that Ebola occurs in poor African nations, is that a disincentive? I'm going a bit conspiracy theory here, folks. Is that a disincentive for research and money being poured into finding a cure or finding a good vaccine for this?
You're touching on ethical issues, really, aren't you? And I think there are a number of ethical issues to think about in this context. That argument has certainly been aired in the media and in discussion. And I suppose one has to look at 2 points of view. One is the total number of cases affected and the history of outbreaks in the past, which is that they've generally been contained. The total number of cases that we are seeing at the moment, frightening as though it seems with the sort of rate of transmission, is still less than 5,000. And I'm saying 5,000 because I'm sure not all cases have actually been recorded.
Yeah.
So on that side of the coin, if a pharmaceutical company is looking at trying to develop something that's going to make a profit, you could argue that that's a limited number of cases compared with the millions with HIV and malaria. On the other side of the coin, this is a disease with high mortality. The affected communities are absolutely decimated by it. And I think what we do need to be looking towards is a preventative for the future, and I do see a role particularly for vaccine development in this context. How that will play out in the overall global situation will very much depend on the ability and the willingness of developed countries to help pay for the product and to help its distribution in developing countries.
Right. Am I right in saying this is the largest Ebola outbreak ever?
It is. The second largest one was in Uganda in 2000, and that was in the order of hundreds of cases. Right. We've never actually seen something of this scale. And the current WHO estimates are we could be looking at 20,000 cases within the 6 months it's going to take to really get this under control.
Right. Are we paying an awful lot of attention to this disproportionately, given that we don't think it's going to come to us in that sense? Are we scared for no reason?
I I would say we shouldn't be scared about our country, but we should be scared for those countries that it's affected.
Exactly.
And as Tania said, it's having a devastating effect on the economies in those countries. Just to get a virus like this under control is going to cost a huge proportion of their GDP. Villages are no longer functional, they're not producing crops, so it's all these compound effects that it has. So I think we should be scared for them and be working as a global community to help them.
There was an additional ethical concern raised in an article that was published in The Conversation recently, which is really to do with one of the drivers for development of these vaccines and drugs being concern about use of this virus as a bioterrorism kind of threat.
Right.
Personally, I don't think it's an efficient virus and that it is really not suitable for such a use. But I do raise it because it has been mentioned in the consideration of the ethics of what's happening in response to this epidemic at the moment.
That Australia is pretty well prepared, and that, as you said earlier, Grant, we need to be concerned for those countries that are going through this rather than ourselves. Yeah?
Yeah, so looking at the global response so far, there has been quite a strong global response. Some people would say it might have been slightly slow at the start, but certainly now it's been ramped up to the stage where there is a good response on the ground. But as many articles have said recently, it's really tested the resources of things like the WHO, Medicines Sans Frontières, the US CDC, to be able to put in-country support in place for these.
So there are a couple of issues in the context of Australia and developed countries, and I think we shouldn't underemphasise that it is really important that we be prepared, and that there are pandemic plans in place. Each of the states or jurisdictions is also highly focused on how we would manage a patient or a person that happens to reach this country who does have Ebola. We've been in New South Wales, we have a designated hospital to receive patients, which is Westmead Hospital. There's a high security laboratory there to make the diagnosis. We've been actively upgrading our plans for transport of patients in the event that one arrives here, and for looking after them in the hospital, and for making sure the infection control procedures are in place. There was, however, a couple of interesting articles or editorials in the Annals of Internal Medicine in the last few days where we have to be careful we're not overdoing the preparation for infection control in terms of the personal protective equipment that people are concerned to use. I think inevitably with the fear around this disease, there's an expectation or a requirement, if you like, on the part of people having to look after potential patients that they need the highest level of security instead of the most appropriate level of security.
Right.
And these editorials actually did raise the point that if you're using the highest level of security, there might in fact be some risk in that, because you're not used to the clumsiness that comes with this high level personal protective equipment. And in fact, part of the potential time of transmission is when you're trying to take off with all of this equipment, where you might inadvertently wipe your brow or something. So it's not only using personal protective equipment that's appropriate for purpose, but also making sure that you actually don it and dispose of it, or rather take it off and dispose of it appropriately. I think that's true. We are well prepared, but there is still a level of anxiety and fear, and that very much needs to be supported, and really it'll be through training and making sure that people are prepared, that we can cope with the situation appropriately.
Has there been an appropriate government response?
Oh, I think so. The Chief Health Officer has been intimately involved, and in fact he is also linked with WHO committees, which he chairs, so he's very much in the forefront of our responses.
I think the one area we could think of for Australia is the amount of money that we're actually helping, providing to West African countries to help. So the Australian government announced $1 million last week. But many other countries have given far more, so it's thinking how can Australia help the West African community at the moment.
Terrific. Thank you both for your time today.
Thank you. Thank you.